Childhood Obsessive Compulsive Disorder, a synopsis. Once considered a rare condition, obsessive compulsive disorder, or OCD, is now recognized as the fourth most common psychiatric disorder. The increased awareness of OCD has spawned an increase in research, giving light to various components such as symptoms, causes, triggers, impairment, familial roles, and treatment of childhood obsessive compulsive disorder. Obsessive compulsive disorder is comprised of two components, being obsessions and compulsions. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted. Compulsions can be described as repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. Some symptoms of OCD include such things as obsessive cleaning, obsession with being free from germs, need for symmetry, placing or doing things in a particular order, forbidden thoughts, fear of harm, either to oneself or to others, fear of violating religious rules, and a need for perfection. Another main symptom of obsessive compulsive disorder is that of anxiety. Anxiety is one of the most common associated factors that supports the diagnosis of OCD. Many people with OCD suffer from anxiety and panic attacks and therefore resort to the avoidance of things, places, or people that might trigger such feelings. There have not been any definitive components attributed to causing OCD. However, it is strongly believed to be caused by a combination of several factors, including such things as biological, genetic, behavioral, cognitive, and environmental. Triggers. While not viewed as causes, there are certain criteria that are considered to trigger the onset of childhood OCD. These can include things such as extremely stressful events in the life of a child, abuse, being that of physical or sexual, experiencing a traumatic illness, or even exposure to certain viruses or an autoimmune syndrome. Pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections is one of these viruses. This is known as PANDAS. Impairment. OCD is often linked with a reduced quality of life, including social, educational, and occupational hindrance. Research indicates that at least 50% of young people with OCD suffer substantial impairment in social, academic, and family-related functioning. Educational impairment is prominent in children with OCD, as their obsessions and compulsions can interfere with things such as sleep, homework, attentiveness, and self-esteem. Age at diagnosis. The age of symptom onset in childhood OCD can vary. However, there are several peak years throughout childhood and adolescence in which diagnosis tends to peak. From the chart below, you can see that there is an onset peak at age 5, a peak at age 7, age 11, and with the highest peak in the year of 17 years old at adolescence. There are certain factors that set childhood obsessive compulsive disorder apart from that of adult OCD. Childhood OCD is often more difficult to diagnose due to children having poor insight into the nature of their obsessions and limited verbal expression. Obsessions related to fear of harm and/or separation are much more common in children than in adults. Children tend to be more geared toward rituals that involve family members. And gender differences in childhood OCD poses a higher diagnosis of males versus that of adulthood, which leans toward a higher diagnosis of females. The role of the family can be substantial in and throughout the course of childhood OCD. One main way the family is influential is through cognitive development. A child's belief about their role of responsibility in the family can be amplified if they are expected by family to bear the load of a caregiver. Parental criticism and overprotection can contribute to an exaggerated sense of fear and/or worry, which can lead to avoidances. Familial demonstration of attitudes or beliefs originating from an influential area in which failure to hold to such beliefs would result in guilt, blame, or punishment. The family plays a vital role in whether a child's OCD improves or worsens. One area that is impacted is a family's accommodations. A family can accommodate a child's OCD through verbal reassurance, active participation in rituals, enabling avoidance of stressors, decreasing a child's normal responsibilities, or even antagonizing a child regarding their rituals. Due to the undeniable familial influence on childhood OCD, treatment involving the family plays a key role in childhood OCD recovery. Some forms of treatment involving the family are family therapy and family education, which should include helping the family know how to recognize OCD behaviors, helping family members know how to talk to children about their OCD, helping children change their responses, helping family know how to model behavior goals, and to know how to support the child, not the disorder. Another form of treatment for OCD is cognitive behavioral therapy, also known as CBT. This is one of the most successful treatments for OCD. In CBT, a client and therapist will work together through various activities and tasks in order to help the client overcome their condition. This helps the client to examine their relationship between their thoughts, feelings, and behaviors, and helps them to identify self-destructive behaviors and negative thought patterns that give rise to them. A form of cognitive behavioral therapy is exposure response prevention therapy, also known as ERP. This is considered to be highly effective in the treatment of childhood OCD. ERP sessions consist of exposing the client to their fear or obsession in a controlled environment and pace, while at the same time preventing them from acting upon their compulsions. As sessions continue, clients tend to develop a tolerance to what formerly caused them anxiety. The treatment success rate of ERP is so substantial that it's been recognized and recommended by the National Institutes of Mental Health, the Mayo Clinic, and the Harvard Medical School. Medication is another form of treatment for OCD. The use of treating childhood OCD with medications is controversial due to the possibility and degree of side effects. However, research has proven that antidepressants counteract the biological aspects of OCD. Thus, careful case-by-case consideration is needed when determining if medication is an appropriate treatment method for a child with obsessive compulsive disorder.